Hello guys, welcome to Dr. Sam's anatomy classes. Myself is Dr. Azmi Mohsin, Professor of Anatomy. This presentation is about the muscles of leg. This is in sequence with my earlier two lectures. I believe you must have watched those videos. One was on the muscles of the gluteal region and then the muscles of the thigh. Similarly, now I'll be teaching you about the muscles of the leg, and the mode of teaching will be same. It's through self-assessment test. So each of my slides are giving you 15 seconds to revise. There will be a muscle to identify the muscle and its nerve supply. You memorize your answers, and then I'll be teaching you about the muscle in detail. Okay, so I believe you all are ready now. Let's begin. Identify the muscle and its nerve supply. Okay. Okay, so the muscle you're seeing in the image is Tibialis Anterior. This muscle is of the front of leg, of the extensor compartment of leg, and it takes origin from the lateral surface of the tibia, from the upper to third surface of the tibia, and also from the adjoining interosseous membrane. This muscle then descends, there are two bands of extensor retinaculum there at the ankle. The upper one is a transverse and the lower one is a Y-shaped band with the two limbs on the medial side and the stem on the lateral side. That's how the two extensor retinaculum are placed here. Okay, so this muscle, tibialis anterior, it will be the most medial structure to emerge out to the extensor retinaculum, and it will pass through the two limbs of the Y the lower band of extensor retinaculum, and it descends down, and you can see it reaches on the medial side of the foot and gets inserted here onto the base of the medial cuneiform and the base of first metatarsal bone. And it's the same place where a muscle from the lateral side of the leg, lateral compartment of the leg, reaches down into the sole and becomes the muscle of the fourth layer, and that is Peroneus Longus. That also inserts into the same two bones, that is medial cuneiform and the base of the plantar surface of the base of the first metatarsal bone. So together the two muscles, Peroneus Longus and Tibialis Anterior, they form a sling, and that sling helps in maintaining the posterior transverse arch as well as the medial and lateral longitudinal arches, the two muscles on the two sides. Okay, and now the action of this muscle primarily is, of course, the dorsiflexor of the foot, being the muscle of the front of leg, the extensor compartment. So it extends the ankle, or you can say it dorsiflexes the ankle. And the other action is that it also helps in inversion of foot. Okay, inverting the foot, that means the plantar surface should face medially. Okay, so, and the nerve supply, I think it's very easy in case of lower limbs. In fact, in the thigh as well as in the leg, it's all easy because there are compartment based nerve supplies. So let me tell you, there are 4 muscles in the front of leg, and all of them are innervated by the deep peroneal nerve. So that is the nerve supply of tibialis anterior as well. Okay, identify the muscle and its nerve supply. Okay, so this muscle is, you can see here, it takes origin from the fibula, right? Anteromedial surface of the fibula, it takes origin from the upper 1/3 of the shaft of fibula anteromedially, as well as from the middle 1/3, but from the lateral, anterolateral portion of the fibula, leaving a space medially for the extensor hallucis. So there you can say it takes origin actually upper 1/3 the complete shaft on the anteromedial surface, and in the middle 1/3 only on the anterior surface, because in the middle 1/3 there are two muscles arising. So this muscle, after taking origin from the upper two-third of the shaft of fibula anteromedially, and of course it also takes origin from the adjoining interosseous membrane in the upper 1/3. And then this tendon, you can see it descends down and it passes through both the extensor retinaculums, and this digitorum, it passes through the stem of the Y shaped lower band of extensor retinaculum. So this is extensor digitorum longus, and it is splits while it passes through the lower band of extensor retinaculum. It is splits into its 4 tendons for the 4 digits, and all of them, they pass down crossing the metatarsal joints, intermetatarsal joints, then metatarsophalangeal joints, interphalangeal joints, and ultimately they insert onto the base of the dorsal aspect of the terminal phalanges of the 4 toes. So this was extensor digitorum longus, and nerve supply is deep peroneal nerve action. Of course, it is the extension of the prime action will be the extension at the terminal IP joints, but the secondary actions will be extension. The primary action kya hoga? It will be the extension of terminal IP joints, for which purpose it is inserting onto the terminal phalanges. Then secondarily, of course, it will extend all the joints in its course. That means it will also extend the proximal IP joint, it will also extend the metatarsophalangeal joints, and also the ankle joint as well. So it is the dorsiflexor of the foot, and nerve supply is deep peroneal nerve. Then identify the muscle and its nerve supply. Okay, this muscle is, you can see its insertion also. By seeing the origin and insertion, you should have guessed that it takes origin from the middle 1/3 of the shaft of fibula on its anteromedial surface, as well as from the adjoining interosseous membrane. Got it? And then it descends down and it passes through both, it's this tendon which crosses from lateral to medial side. There is nerves and vessels in between, and so it crosses the nerves and vessels from lateral to medial side, and it's the second most structure to emerge out from the extensor retinaculum, passing through the upper and lower band and through the 2 limbs of the Y of the lower band of extensor retinaculum, and then it crosses the joints intervening, and ultimately you can see it reaches to insert onto the base of the dorsal aspect of terminal phalange of the greater toe. So the prime action will be extension of the terminal IP joint, and of course secondary action will be extension of the metatarsophalangeal joints, because you have only one interphalangeal joint there in the greater toe. It will also extend the metatarsophalangeal joint as well as the ankle joint. So these are the actions of this extensor hallucis longus muscle. Okay, and nerve supply, of course, is deep peroneal nerve, which this nerve actually reaches from the lateral compartment into the anterior compartment by piercing the anterior intermuscular septum, and then it pierces extensor digitorum, and then it also the neurovascular bundle in the front of leg is between tibialis anterior and the rest of the muscles that take origin from the fibula. It's the only tibialis anterior that arises from the front of tibia in the anterior compartment. The rest three muscles, they take origin from the fibula. So the neurovascular bundle lies between tibialis anterior and the three muscles on the lateral side. So in short, let me tell you that deep peroneal nerve pierces extensor, extensor, digitorum, supplies all the muscles there. Okay. Then identify the muscle and its nerve supply. Okay, so this is the fourth and the last muscle of the front of leg that takes origin from the lower 1/3 of the shaft of fibula anteromedially, and it passes down below both these extensor retinaculum, and it passes along with the extensor digitorum through the stem of the Y of the lower band of extensor retinaculum and reaches down to insert onto the base of the dorsal aspect of the fifth metatarsal. Got it? So nerve supply, you know, is the peroneal nerve, and the action will of course be extension or the dorsiflexion of the ankle, as well as it will also assist in eversion of the foot, just like the other peroneal muscles. Okay. Now identify the muscle and its nerve supply. Now this muscle is Peroneus Longus. It's the muscle of the lateral compartment of the leg, and it takes origin from the upper 1/3 of the lateral aspect of the fibula between anterior and posterior intermuscular septum. That is like, you know, there is compartmentalization of the leg. So this lateral compartment is divided or is bounded anterior and posteriorly by the anterior and posterior intermuscular septum. So it takes origin from the upper 1/3 of the shaft of fibula anterolaterally on the lateral surface, upper 1/3, as well as from the adjoining intermuscular septum, and right, and the common peroneal nerve, which divides into its two terminal branches here at the neck of fibula. It's happening here at the neck of fibula. And the deep peroneal nerve, as I told you, it pierces the anterior intermuscular septum and reaches into the front of leg, while this superficial peroneal nerve, that is important, is that the superficial peroneal nerve continues to run under the substance of this muscle, Peroneus Longus. So this muscle is innervated by superficial peroneal nerve on its deeper aspect, on its deeper surface. Okay, so that was the nerve supply. Action, of course, it's a lateral of the peroneal compartment, or the fibular compartment. The purpose of the muscles of this compartment is eversion of the foot. And let me tell you, this muscle also passes behind the lateral malleolus, and there is this peroneal retinaculum. There are two bands here also, upper and lower band of peroneal retinaculum. It passes between the two, while in the lower band of the retinaculum there is, on the lateral aspect of the calcaneum, there is a prominent tubercle called peroneal trochlear. That these two muscles are initially in a common synovial sheath, but there at the lower band of extensor peroneal retinaculum, which is split into two by this peroneal tubercle on the lateral aspect of the calcaneum, and so the two muscles there have different synovial sheaths. And then Peroneus longus, you can see it winds below to this on the plantar aspect to the base of this fifth metatarsal, and wind from lateral to medial side, crossing the tarsals, the distal row of the tarsal bones, and reaches down here onto the medial aspect where this tibialis anterior was inserted. I told you on the same point, that was medial on the plantar surface of the base of the first metatarsal, and medial cuneiform on the lateral side, while on the same two bones, plantar aspect of the first metatarsal and medial cuneiform on the medial side, it was Tibialis Anterior. Got it? So this way you can see on below to the sole on the foot under surface there is this winding of this tendon. Got it? And this tendon grooves below the cuboid, right? And grooving the cuboid, it forms the cuboidal tunnel here, right, through which this passes. And so together, as I told you, the two muscles will be like a loop, will form a sling onto which your foot is kept. So together, when the two muscles will pull up, this will help in maintaining the posterior transverse arch, as well as separately, Tibialis anterior maintains the medial longitudinal arch, Peroneus longus will maintain the lateral longitudinal arch. Got it? So these and of course the action of Peroneus longus is eversion of the foot. Got it? So that was about Peroneus longus. Hold on, before I start with this, the Peroneus longus का lateral collateral ligament of the knee joint detached portion होता है, remember that. Okay, so identify the muscle and its nerve supply. Okay, so this muscle, you can see it's taking origin from the middle 1/3 of the lateral surface of the fibula. This also is taking origin from the adjacent anterior and posterior intermuscular septum also. And this muscle descends down, and you can see it also passes behind the lateral malleolus, passing through the two retinaculum, peroneal retinaculum, superior and inferior, and inferior through this peroneal trochlear or peroneal tubercle, it gets separated from Peroneus longus, and this one is Peroneus brevis. So Peroneus brevis, you can see it is attached to the prominent lateral process of the base of fifth metatarsal, that is called the styloid process of the fifth metatarsal. This is a bony prominence which you can very easily palpate on your foot. If you palpate the lateral border of the foot from the little toe to the heel, in the midway you will find is a bony prominence, and that is the styloid process of the fifth metatarsal. And so this Peroneus brevis is attached to the styloid process of the fifth metatarsal. Got it? And it will cause eversion of the foot, and will also help in maintaining the lateral longitudinal arch. And the nerve supply will be, hold on, the two muscles in this compartment, both Peroneus longus and Peroneus brevis, they will be innervated by superficial peroneal nerve. But important is, Peroneus longus, I told you here, it was being innervated by the superficial peroneal nerve on its deeper aspect, while after crossing this Peroneus longus, this nerve becomes superficial, as the name is, superficial peroneal nerve. So now it will supply Peroneus brevis on its outer surface. Got it? Peroneus longus on its deeper surface, Peroneus brevis on its outer or superficial surface. That's how superficial peroneal nerve courses, and then it winds and becomes superficial after piercing the deep fascia and reaches to supply the skin of the dorsum of the foot. Okay, so that was about Peroneus brevis. Nerve supply, superficial peroneal nerve, that is the nerve of the lateral compartment of the leg. Identify the muscle and its nerve supply. The green color muscle. Okay, so the green color portion, this muscle actually you're seeing is in the back of leg, right? So we have done with the front of leg, the lateral compartment of leg. Now what you're seeing is the muscle of the back of leg, and in this back of leg, this muscle you can see is coming from above the knee joint, right? So that means it's coming from the femur, right? Your femur, just like humerus at the lower end, has two condyles. Femur also has two condyles and two epicondyles and two supracondylar ridges. So from the medial supracondylar ridge, there is the medial head of gastrocnemius takes origin. From the lateral supracondylar ridge, there is lateral head of gastrocnemius that takes origin, and the two heads they form the inframedial and infralateral boundary of the popliteal fossa. So you can see that this is the superficial most muscle in the back of leg. The two muscles, then two heads, then they join and they descend down. It's a bipinnate type of muscle. The two heads then join and they become tendinous in the lower half. You can see this white type of thing here. It becomes tendinous, right? And then it, the muscle deep below is soleus that also merges with its tendon, and the two together form the tendoachilles or tendocalcaneus, and then they insert onto the, you can see the insertion of this gastrosoleus tendoachilles onto the posteriorly. There is a tubercle on the calcaneum, and the two actually tubercles on the posterior aspect of calcaneum, medial and a lateral. So remember, the medial one tubercle, it will be insertion of Plantaris. However, gastrosoleus will insert onto the lateral tubercle on the posterior aspect of the calcaneum. Okay, so the green color thing which is being asked here in the question is medial head of gastrocnemius, right? So this medial head of gastrocnemius, what special things you know about this medial head? One thing is that of course it forms the inframedial boundary of the popliteal fossa, and it is associated with a bursa below it, and that's called Brody's bursa. Sometimes there is any infection in the synovial cavity of the knee joint or some injury might lead to inflammation of that bursa, and there will be a abscess in that bursa, and that's called Brody's abscess. So with the medial head of gastrocnemius, just remember it is associated with Brody's bursa just below to this medial head of gastrocnemius. Okay, let me tell you, the muscles of the back of leg, you need not worry, the nerve supply is same for all of them, and that is tibial nerve, right? Tibial nerve is L4, L5, S1, S2, S3 dot ventral division. For common peroneal, L4, L5, S1, S2 dorsal division. Here you have all of them of ventral division. So that is about tibial nerve, which runs into the through the as a content of popliteal fossa and reaches into the back of leg and supplies all these muscles. Got it? Okay. So now the muscle in the question is identify the muscle and its nerve supply. I think it's easy now. It's the same muscle, that is gastrocnemius, taking origin from the medial lateral supracondylar ridges of the femur, descending, both of them descending down, and all about its gastrocnemius, the superficial most muscle on the back of leg, and together they form the tendoachilles and inserts onto the medial tubercle on the posterior aspect of calcaneum. Got it? And the green colored thing is the lateral head of gastrocnemius. So what special point about the lateral head of gastrocnemius? The lateral head, the action, the important thing, remember, it's this lateral head of gastrocnemius has sometimes a sesamoid bone in its tendon, and that is called fibula. Clear hai? So with the medial head of gastrocnemius, you should remember Brody's bursa, and with the lateral head of gastrocnemius, you should remember there is a sesamoid bone sometimes, and that's called fibula. Got it? Nerve supply is tibial nerve. Action, of course, remember, is a powerful anti-gravity muscle, right? Why is a powerful anti-gravity muscle? It helps you elevate your body on the toes. Means it's a powerful plantar flexor of the ankle joint. So it helps you, make you stand on your toes. So that means it's a powerful anti-gravity muscle. Okay? Along with a muscle below to this, and that is Soleus. Okay, then identify the muscle and its nerve supply. Okay, so this muscle you are seeing is also the back of leg, also is considered as a muscle of superficial compartment of the back of leg. Okay, so look at the shape of the muscle, right? This looks like to be the sole of a shoe, right? Sole like so plantar aspect of your foot. So that's why, because it looks like a sole, so that's why it's called soleus. And important points, let's first talk about the origin insertion point. So you can see it has this prominent upper end pointing reaching to the posterior aspect of the head of fibula, right? So it takes origin from the posterior aspect of the head of fibula. Then also there is an oblique line on the tibia posteriorly below to the insertion of Poplitius. There is an oblique line. From that oblique line also there is origin of Poplitius from here, right? It's an oblique line, so it takes origin from both the muscles, right? Posterior surface of the head of fibula as well as from the oblique line on the tibia. What does it reminds you of? Some muscle in the does it reminds you of any muscle in the front of forearm, right? Front of forearm is same as back of leg, got it? They are homologous. Both are the flexor compartments. The homology says that the front of leg, of forearm and back of leg are same. So tell me, this soleus mimics which muscle in the front of forearm? So remember, there also is a superficial muscle which also takes origin from both radius and ulna. Although this muscle also takes origin from the medial epicondyle of humerus, and the muscle is flexor digitorum superficialis. Okay, so there was also an oblique line, if you remember, on the radius, on the anterior aspect of the radius from the radial tuberosity, there was an oblique line. So similar was the origin of flexor digitorum superficialis, that it takes origin from the radius, medial epicondyle of humerus, as well as from the oblique line on the front of shaft of radius. And that muscle was also superficially, or you can say intermediately running muscle in the front of forearm, and it was also bulky muscle. This one also is muscle, bulky muscle. So you can think about the same is the origin of this muscle from both fibula and tibia. Then the another important point about this muscle is that it's bulky muscle. It's the most bulky muscle here in the back of leg, and it has a lot of venous sinusoids, right? So it has a lot of venous sinusoids, means for the collection of blood, and that's why this muscle is also called a peripheral heart, because from outside there's a thickened deep fascia covering the back of leg, and deep down below there are muscles and the bony portions, right? The bones. So when it contracts, when you walk, actually you are all the time plantar flexing your foot, so it contracts, and in that process, because of the valvular action as well, there are unidirectional valve, like pushing the venous blood up towards the heart, anti-gravity way. So this calf muscle soleus helps to push up the blood against gravity, the venous blood, and that's why this is called peripheral heart. Okay, so down below now you see this tendon of this soleus merges with the tendinous thickening of a muscle superficial to it is gastrocnemius. Together the two tendons join, and that's called tendocalcaneus. I told you it inserts onto the posterior tubercle the medial tubercle on the posterior aspect of the calcaneum. Hold on, let me tell you, this will insert onto the lateral tubercle on the posterior aspect of calcaneum. Medial को याद रखना, medial पहले बताया था, medial will be for plantaris. Okay, so that was about the origin insertion. Nerve supply, I need not to tell you, it's all about tibial nerve which supplies this muscle, and the action I have told you is plantar flexion, a powerful anti-gravity action, and that is plantar flexion of the foot. Now about identify the muscle and its nerve supply. Okay, so this muscle you are seeing is taking origin from the lateral supracondylar ridge of femur, just above the origin of lateral head of gastrocnemius. There, right? So you've seen its origin from the above the lateral head of gastrocnemius, from the lateral supracondylar ridge of femur. So the muscle is, and you can see it's very thinned out muscle, like tendinous muscle, right? Although not much in use. So the muscle is plantaris. Got it? So one thing, if you remember, I keep on reminding you, and this is where it keeps you help remember the things. Tell me a muscle. I mean, of course, I could not ask you that, but I'm telling you that you should remember there are oblique muscles in each compartment, right? Upper limb I'm not going to discuss, which I'll discuss later on. In the lower limb, front of thigh has an oblique muscle called sartorius. Back of thigh has an oblique muscle, I told you, and that was, yes, that was biceps femoris, being in oblique in course, so it was covering sciatic nerve from behind, right? And then the medial compartment, although not exactly oblique, but that was gracilis, which was running down to bypassing femur to insert onto the tibia. Okay, now here the muscle which is running obliquely in the back of leg is plantaris. So if you have this mind that this muscle, you can see, although very thinned out tendinous, but it has an oblique course. So, and one thing you've been taught is that it takes origin from the above the lateral supracondylar ridge of femur. So that means being oblique, it will insert medial to tendocalcaneus. This you should remember, right? So that means, as I was telling you, that calcaneum posteriorly has two tubercles. On the medial one, it will be plantaris that will insert, and on the lateral tubercle on the posterior aspect of the calcaneum, it will be tendoacalis that will be inserted. Okay, so the muscle is covered by gastrocnemius soleus, right? And this muscle nerve supply is tibial nerve. And action wise, of course, it will be a weak plantar flexion. Got it? And don't forget, yes, something very important I left out about plantaris. The detached portion of plantaris is supposed to be the plantar aponeurosis, like plantar fascia on the on the plantar surface of the foot. So that plantar aponeurosis is a detached portion of plantaris. Similarly, if you've been asked sometimes, like there's long plantar ligament in the sole, and that long plantar ligament is supposed to be the detached portion of gastrocnemius. Okay, remember this. Now identify the muscle and its nerve supply. Okay, so this muscle you are seeing, first of all, you can confirm it by seeing this image, that it is going down to insert all to the 4 digits, right? So if it's inserting on all the 4 digits, that means it's of course a plantar nerve. So what type of digital nerve, because it's reaching to the 4 digits. So important point here is that this muscle, because it's a muscle of the back of leg, so of course that's a flexor compartment, this muscle is flexor digitorum, right? But the important and difference between the muscles of the forearm and muscles of the back of leg, both are comparable, both are flexor compartments. But in the front of forearm, if you see the deep muscles, there was flexor pollicis longus and flexor digitorum profundus. Flexor digitorum, because it's a digitorum for the 4 digits, so it takes origin from the medial bone, that is ulna, and reaches to the 4 medial digits straight away. While flexor pollicis longus takes origin from the front of radius, and it reaches down to the thumb, that is the lateral most digit, from the lateral bone to the lateral digit, from the medial bone to the medial 4 digits in the hand on the upper limbs, right? Now here it is not happening. So the important is, that's why you can remember this, there is actually crisscross happening, like the two muscles are crossing. So remember, the homology should be like, digitorum is for the digits and the lateral bone is fibula. So ideally should have been arise from the fibula to reach the toes. Similarly, flexor hallucis longus, which is like medially placed toe, so hallucis longus should have been taking origin from the tibia, but it is not so. The two muscles have replaced the sites of origin, right? Remember, keep looking here. Now, this muscle, it is flexor digitorum longus, and digits are laterally placed. So, it takes origin from the medial bone. Remember, flexor digitorum longus takes origin from the posterolateral surface of tibia. Got it? And it will of course descend down, pass through the flexor retinaculum, that is from the medial posteromedial to this medial malleolus, and that's how it reaches into the sole to become the muscle of second layer of sole, and it reaches down and inserts onto the plantar aspect of the terminal base of the terminal phalanges of the four laterally placed digits. Got it? And in its course, remember that these long tendons will also provide origin to the four lumbricals of the sole, which are also muscles of the second layer, right? So these lumbricals, unlike the palm, in the palm you had like two medial lumbricals which were bipinnate and two lateral lumbricals which were unipinnate. But here in the sole there are four lumbricals. The medial one, the medial most is unipinnate, and the lateral three are bipinnates. These lumbricals also take origin from the tendons of flexor digitorum longus. So you have seen that this is the course of this digitorum longus muscle. It should have taken origin from fibula, but it's not taking origin from fibula, rather from the medial bone reaching into the lateral toes, right? So that was about flexor digitorum longus. And I told you the nerve supply of all the muscles of the back of leg is tibial nerve, and of action for this muscle will of course be plantar flexion as the prime action. If it's like the purpose of this muscle is to flex the terminal IP joints, right? To flex the terminal IP joints, that is the prime action of the muscle. Secondary action will of course the flexion of proximal IP joint, flexion of metatarsophalangeal joints, flexion of the ankle joint, as well as it will also help in inversion of the foot. And along with all this, it also helps to maintain the medial longitudinal arch of the foot. Got it? So these are few actions of this muscle, flexor digitorum longus. Nerve supply, is tibial nerve. Okay. Now, in this muscle, identify the muscle and its nerve supply. Okay, now as already told you, because you can identify easily that there is a single tendon reaching to the base of the greater toe. So this will be hallucis, right? And because from the back of leg, so it's a flexor muscle. So this muscle is flexor hallucis longus. And I already told you that if you compare the homology from the forearm to the back of leg, front of forearm to the back of leg, then flexor pollicis longus takes origin from the lateral bone and reaches to the lateral digit, straight course. Here it is not so, that the muscle for the greater toe is taking origin from the which is medial digit, and it takes origin from the lateral bone. So remember, flexor hallucis longus takes origin from the posteromedial surface of fibula, as well as it crosses this flexor retinaculum. And then after emerging out of the flexor retinaculum, of course, remember, now think about this muscle from tibia that was taking origin was flexor digitorum longus, it has to reach to the laterally placed toes. And this muscle taking origin from the lateral bone is flexor hallucis longus. It has to reach medially in the foot, on the sole. So that means the two muscles will cross each other, right? So this crossing happens. Where does this crossing happens? This crossing happens below to the spring ligament. Below to the spring ligament, the two muscles cross each other, right? So below the spring ligament, which binds the head of calcaneum to navicular bone, and from the apex of the medial longitudinal arch, onto which the head of talus is resting. Calcaneum और navicular को bind करके रखती है ये spring ligament, and onto that there is a hollow socket formed, and onto that there is this head of talus is resting. So the talocalcaneal navicular joint is actually a false variety of ball and socket joint, and because the socket is being formed by two bones, right, and that the socket is being held up by this spring ligament. So the purpose of this crossing, I believe now you would understood that why these two long tendons were crossing, and the crossing of the two tendons were happening below the spring ligament. Remember, hallucis passes straight, while this digitorum crosses superficially, like on the plantar surface. It crosses the flexor hallucis longus and then reaches to the lateral side. And this crossing actually, now you got the purpose, is actually to reinforce the strength of spring ligament. Got it? The action of flexor hallucis longus, if it's asked, the prime action, of course, for which the muscle is meant, is to flex the IP joint of the greater toe. Apart from that, it will also flex the metatarsophalangeal joint and the intertarsal joints, as well as it will also cause plantar flexion of the ankle joint. And don't forget, it's a string shaped thing, right, straight from the one pillar to the other pillar of the medial longitudinal arch. So it of course is maintaining the medial longitudinal arch of the foot as well. Got it? So these were the actions of flexor hallucis longus, and the nerve supply is tibial nerve. Okay. So that was about flexor hallucis longus. Okay. Now the next muscle is identify the muscle and its nerve supply. Okay, so this muscle, you observe very carefully, it has a lot of special peculiar points to remember. First of all, this muscle you can see is the deepest muscle of the back of leg, if it's asked, right? One point is this, it's the deepest muscle of the back of leg, because you can see it takes origin from both the bones, right? Lateral surface, posterolateral surface of the tibia, posteromedial surface of the fibula, as well as the posterior surface of the interosseous membrane. So it is the deepest lying muscle in the back of leg, one thing. Then if you take a transverse section at the mid of leg, right, transverse section of the leg, then you will find that it is the centrally placed muscle in the leg, right? So deepest muscle of the back of leg, otherwise you can call it as the centrally placed muscle in the leg, is tibialis posterior. Got it? So now look here, now tibialis posterior, you can see is that's the origin, right? It also descends down and winds medially and passes behind the medial malleolus, right, to descend down and reach into the sole and to become the muscle or a tendon, extrinsic muscle in the sole, and it will be counted as the muscle of the fourth layer of sole. Now before talking about the insertion, let me tell you that this muscle also crosses the other muscles. Because if you remember, the structures passing below the flexor retinaculum, they are tall. Doctors are never happy, right? So tibialis posterior is the medial most, then D for digitorum, right? Then R, never, that's artery, posterior tibial artery. Then you have nerve, tibial nerve. N for nerve, never, happy is hallucis, right? So tall doctors, right? Tall means tibialis posterior, and then you have the medial most will be the tibialis posterior, and then it will be the digitorum, the next muscle to descend now. So now think about the structures passing below the flexor retinaculum. Tall doctors are never happy, right? So that means tibialis posterior will be the medial most tendon to emerge out, right? But if you see on the back of leg, tibial, the tibia is from this tibialis flexor digitorum longus, right? Flexor digitorum longus was taking origin from the tibia posteriorly. So ideally, flexor digitorum longus should be the medial most tendon to emerge out, but it is tibialis posterior, because if you see in the back of leg, the medial most muscle there is flexor digitorum longus, and this muscle tibialis posterior is lateral to flexor digitorum longus, because tibia se posteriorly, what is it arising? Tibialis flexor digitorum longus, and tibialis posterior takes origin from the interosseous membrane as well as the adjoining surface of the two bones. So the medial most muscle in the back of leg, in the deep muscles, of course, it is flexor digitorum longus. The next muscle is tibialis posterior. If you go from medial to lateral in the back of leg, in the deep muscles, it is flexor digitorum longus, tibialis posterior, and then flexor hallucis longus, right? So tibia and flexor digitorum longus should be the first tendon to emerge out from the flexor retinaculum, but it's not happening in the flexor retinaculum. It is tibialis posterior that is medial most to emerge out. Got it? By now you should have understood. That means this flexor digitorum longus in its course up to the sole crosses two tendons, right? So remember that before passing through the flexor retinaculum, flexor digitorum longus crosses medial to lateral to this tendon of tibialis posterior. Before crossing the retinaculum and after crossing the retinaculum, it will cross flexor hallucis longus, right? So it means this tendon you are seeing is passing here, it is being crossed by flexor digitorum longus. Anyways, so now this tibialis posterior passes below the flexor retinaculum and it reaches into the sole, and when it reaches into the sole, it reaches primarily to insert on the plantar aspect of the navicular bone. Remember this. But from navicular, it spreads out its aponeurotic expansion to insert on all the tarsal bones, gripping all the tarsal bones together, packing them up, except reaching up to the talus. Talus is the bone where there is no muscular attachments, and any other bone, if you remember, which has no bony attachment, one is talus and the other is incus. That's an ear or middle ear ossicle, right? Incus and talus, the two bones have no muscular attachments. So to all the tarsal bones, this tendon spreads out from navicular, tibialis posterior, and to the base of the middle three metatarsals as well. Got it? Covering this tendon of Peroneus longus, which was going below. And it is presumed, in the third layer of sole, there is this muscle on the medial side that is called flexor hallucis brevis. So remember that this muscle has two heads, flexor hallucis brevis. The medial head of flexor hallucis brevis in the sole is presumed to be an extension of or a detached portion of tibialis posterior. Okay, so there was so much about this extension thing. Now about its action. Tibialis posterior, of course, if it's finding below this medial malleolus reaching into the sole, of course, it will cause plantar flexion. That's like, prime action of the three muscles reaching down from here. So plantar flexion is, of course, the prime action. Then other action is it, by inserting in from navicular spreads to all the bones. So that way it helps to grip the tarsal bones and helps in maintaining the strength of posterior transverse arch of the foot. Remember this point, right? It helps in maintaining the posterior transverse of the arch of the foot, as well as it also helps in elevating the medial longitudinal arch as well. Got it? So these were the actions of tibialis posterior. Nerve supply, of course, is tibial nerve. Identify the muscle and its nerve supply. I believe by now you must have understood that we are talking about this muscle. This actually has stopped. It's a GIF image, but it is stopped anyway. So this muscle behind you are seeing, I mean telling you by this you can understand it, that this muscle takes origin from, it's an intra-articular origin, right? Intra-articular tendinous origin. It has many things in reverse types. Origin is tendinous, insertion is fleshy. One thing. Peculiarities about this muscle you know talking is Poplitius, right? It also is a deep muscle of the back of leg. So the nerve supply, not to say, you should know that it is tibial nerve. Anyway, so Poplitius, the peculiar points. It's its origin is tendinous, insertion is fleshy. One thing. It's a triangular muscle. Then important is that it's an intra-articular origin, right? It takes origin from the lateral aspect of the lateral condyle of femur, right? And so because it's an intra-articular tendon, that means it will have to come out of the knee joint capsule, right? So for this, the tendon to emerge out of the knee joint capsule, there is a space created posteriorly in the knee joint capsule, and that space becomes a weakness in the knee joint capsule posteriorly, and then this tendon comes out and inserts onto the posterior surface of tibia. And on the posterior surface of tibia, I told you there was an oblique line that was called soleal line, and it was providing origin to soleus. So the triangular area on the posterior upper surface of the tibia, there is this triangular insertion of Poplitius above the soleal line. Now think about, if this tendon emerges out of the knee joint capsule, the capsule is become weak because of the opening, right? And so there is this thickening of this opening, that is reinforced. The strength of this opening is reinforced by the expansion from the short lateral collateral ligament of the knee joint, which spreads its ligamentous expansion or the fibrous expansion to thicken the opening of the Poplitius capsule, and that forms the arcuate popliteal ligament of the knee joint. By the way, knee joint, it's the largest and the most complex joint in the human body, and it's unfortunate, its irony is that being such an important joint. It is a weakness. The weaknesses of reason is that its knee joint is thin and it has openings. Anteriorly, it has an opening for the suprapatellar bursa. Similarly, now posteriorly, it has an opening for the tendon of Poplitius to emerge out. So let me tell you that people who, clinical point is here, people who are in a habit of sitting in a squatting position for a long time, right? Such as bakers, bakers जो बेकरी वाले होते हैं, right? So they sit down in squatting position and they work like sitting in that position for a long time. So in that case, if a person starts suffering from arthritis or any infective conditions from the knee joint, or there might be over secretion because of this habitual position of squatting, sitting in a squatting position and working, there is an over secretion of the synovial fluid. So what happens is, like I'm telling you, that what happens is that knee joint in the space becomes compressed and that synovial fluid starts to bulge out posteriorly through this gap, and it fills into the bursa, into the back of knee joint, and that forms a cystic swelling in the back of knee joint capsule. There is a thickening or a cyst formed, and that cyst is called Baker's cyst, right? So with this opening in the knee joint capsule posteriorly, when you come across this, always remember about Baker's cyst, which can be a cause of pain and difficulty in flexing and extending the knee joint. Anyway, so you got to know about origin and insertion of Poplitius. Nerve supplies obviously the tibial nerve, and let me tell you that tibial nerve, while coursing to this popliteal fossa, it doesn't supply this nerve very straight away. It has also a peculiar course. Like tibial nerve to Poplitius is given out from tibial nerve, right? It runs over the surface of Poplitius and reaches its lower border, and then winds upwards on its deeper surface to innervate Poplitius on its deeper surface. Deeper means what? On the bony, the portion attached to the bone. Because इसमें orientation का problem होता है. Sometimes when it is asked what is the deepest structure in popliteal fossa, people think like deepest structure means most behind, but it's not the correct answer. Deepest structure means when you look in popliteal fossa from the back side. So remember, the deepest structure is popliteal artery. Okay, so deepest means like when in concern with popliteal fossa, we talk while seeing from the back side, the diamond shaped fossa. So if you see from the back side, tibial nerve descends down straight into the back of leg, and there it gives this branch above the transverse, near the transverse crease of this knee joint, but it runs over the surface of Poplitius. It doesn't innervate Poplitius. When it reaches the lower border of Poplitius, this nerve twig to Poplitius inserts deep into it has a recurrent course, right? It passes deep to the Poplitius and supplies Poplitius on its deeper surface or anterior surface. That's the way you can remember, right? And one other important point is that this nerve to Poplitius in its course also supplies Tibialis Posterior, right? That was also a deep muscle. So in its course, this nerve to Poplitius also gives a twig to the Tibialis Posterior. So that was about the nerve supply Poplitius. Now action is कभी बड़ा complicated तो नहीं है, easy है, but you should know. Actually, I don't have much time to explain it here, but I'll explain it later on. But one thing you should remember, that action keeps changing with your position of foot on the ground or off the ground. So this should be very clear. When you are standing, your foot is still and it is placed on the ground, right? That means your tibia is fixed in its position. Now what is mobile? It's femur that can be rotated over tibia. So when you are standing, your knees are locked, right? And when you plan to sit down, that means Now tibia is fixed, it is fibula, it's femur that has to flex. So while flexion, tibia, this popliteus pulls this site of origin. It's a reverse type of action, right? Pulls the site of origin, that is the lateral condyle of femur, and it rotates the femur laterally in the initial stages of flexion of the knee joint. So unlocking of knee joint to plans to sit down is done by Poplitius in the initial 15 degrees, and after the by this lateral rotation, the medial condyle of femur is brought out anteriorly of the medial meniscus. So when it gets unlocked, it can easily flex. So this was an action when your foot is on the ground. Now think the other ways. Like imagine you are sitting on a chair and you have lifted your foot above the ground. So in this case, now your femur is fixed in position because you're sitting on a chair and your foot is off the ground. Now in this case, your action will be at the insertion site, right? Because femur will not move, you are sitting on a chair. So now the origin site will pull the insertion site. So like you can imagine, you're sitting on a sofa with your knees extended, right? Foot off the ground. And in this case, you are trying to, extend the knee joint, right? Or rather, flex the knee joint, because extension is locking and this muscle is actually unlocking. So when you are sitting on a sofa, this Poplitius will medially rotate the tibia to bring the medial meniscus over the medial condyle of femur. So this will, in this action, Poplitius is actually medially rotating the tibia when the foot is off the ground. When the foot is on the ground, it laterally rotates femur over the tibia. Clear हो गई बात? अब काफ़ी कुछ हो गया, and of course it also helps in flexion of the knee as well. Okay, so this is done. Summarize the leg muscles. This is the last slide, so pay attention here and we'll summarize it all. Okay, so in this summary, it has to be told to you that in the leg there are 3 compartments. There's a deep fascia covering from all the sides. Remember that the medial surface, anteromedial surface of the tibia is subcutaneous, and the anterior border, there's a S-shaped border. The sharp anterior border of the tibia is called the shin. Anyway, so deep fascia is from the anterior surface of the tibia and winding around and reaching to the medial surface of the tibia. So this leg is being compartmentalized by the anterior and posterior intermuscular septum into front of leg, lateral compartment of leg, and back of leg. So in the front of leg there were 4 muscles, right? And all of them, they were primarily extensors, dorsiflexor of the foot, and the muscles were Tibialis Anterior, Extensor Hallucis Longus, Extensor digitorum Longus, and Peronius tertius. Apart from extension, remember Tibialis Anterior was also a everter of inversion karata hai, inversion of foot, while Peronius tertius was also everter of foot, right? Then from the lateral compartment, the 2 muscles, Peroneus Longus and brevis, both of them were causing eversion of foot, and the nerve supply for lateral compartment was superficial peroneal nerve. For the front of leg, it was deep peroneal nerve. Okay, then back of leg may remember this from superficial compartment there was 3 muscles, Gastrocnemius, Soleus, and Plantaris. Then some people call it an intermediate compartment. There is Flexor digitorum longus and Flexor Hallucis, and the deepest compartment was made up of Tibialis Posterior and Plantaris. Tibialis Posterior and Poplitius. Okay, so these were the muscles of the back of leg. and all of them were primarily plantar flexors. However, flexor digitorum longus and flexor hallucis longus and tibialis posterior, they were also everters, as well as they were also causing inversion as well as maintaining the medial longitudinal arch. Okay, so that was about the muscles of the back of leg, and they were all innervated by tibial nerve. There are a lot of things which need to be discussed and told to you when I'll be teaching them on the board. Okay, so I think this is done. Okay, thank you.